some crazy, like, I don't even know what I'm doing here. At one point, I was like, why am I doing this? Like, this is so stupid.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. If any of you are interested in the ultra running world, our next guest does not need an introduction. But if you're not, she's also a physician. She's an OBGYN, and she has a new podcast with a pelvic floor PT. So automatically, we love her. So Dr. Lauren Puretz, welcome to the podcast.
Yeah, thanks for having me.
All right, so if people aren't familiar with who you are, tell us about all the hats that you wear, and we will just wait.
Gosh. Yeah, right. I always kind of joke that I have like 4 full-time jobs that I am not very good at any of them, but I do them all. So I am an OBGYN. Have been out of residency, so in practice since 2013. So what is that, like 12 years? And then more recently, lots of drama, lots of whatever, but the company I had worked for since out of residency decided to close all their specialties, which includes gynecology and obstetrics. So now I am a business owner. We just passed our 1-year anniversary of opening our private practice. Yeah. So me and my partner, Dr. Key, she does obstetrics and gynecology. I actually dropped obstetrics a little over 2 years ago, maybe like 2.5 years now.
Mm-hmm.
So I just do gynecology. And so, yeah, business owner is my newest hat. And then I am married to another physician. He's a neurologist, so like way smarter than I could ever be. And we have 2 kids, a 13-year-old girl, which is super fun, and a 10-year-old boy. And then in all my free time, I enjoy running way too much. For a normal sane person. So first started with, I guess, like I ran in college, like road marathons, kind of took a little break after, I guess during pregnancies, and then started running road marathons again after my second. And then was like, I'll try 50K, kind of moved out to Colorado where like people run all the time too. And so I was like, oh, that's kind of an interesting concept. And then it has just progressed to longer and longer races. So now I'm doing 100-mile races is I think my favorite. 100K, 100 kilometers, which is like 60, 62 miles, and 100 miles are kind of my favorite distances.
And they're not only your favorite, but you did a thing recently. What did you do?
Yeah, so I went a bit out of my comfort zone and also figured if I was going to do it, I'd go big time and did Ultra Marathon Mont Blanc or UTMB, which is kind of, I don't know, I always say it's kind of like the World Series of ultra running. But also it's in France. So that's pretty exciting and fun. So I was kind of like, well, you know, I might as well go and I'll enjoy France if nothing else. And like I said, although it's 100 miles, I'm more of a road runner convert who runs ultras. So mountain running is not really like what I'm probably better at. But thought, why not run 108 miles with 32,000 feet of elevation gain starting at 5:45 p.m. for the first time I've ever run overnight and with that much vertical. And so went over and kind of with very low expectations, very high chance that I would drop, and completed the loop, which was my goal. But actually, shockingly, I should say, finished 8th overall and first American, which is still to this day, I think it was like a month ago.
Yeah.
Still shocks me.
Yeah. No, I followed along a little bit and then tears watching your kids join you go across the finish line because they're going to remember this.
I know.
They're at the age they will remember. Like, what did that feel like?
It was pretty cool because like I said, I didn't think I was gonna finish,
Okay.
and so multiple reasons I didn't think I'd finish. Way, it's really long. B, overnight.
Yeah.
I've never run overnight, and C, it's ton of climbing, and so and I don't do well in the cold. I have really bad
And that was a
Raynaud's.
rough one, wasn't it?
Yeah, it rained at the start.
Mm-hmm.
And then that, as we went up in elevation, turned into snow, which then turned into hail, which then turned into snow again. This all happening like 6 p.m. and later. I want to say maybe around like 2 a.m. it stopped
Oh
raining.
my God.
So I like didn't have function of my hands for many hours, and I had gloves, hand warmers, and then like waterproof mittens over top, and I
Mm-hmm.
still had like no function in my hands for so long. So just getting through the night, being able to eat, and also all your layers of like, where's my
Right.
food? Because I don't know if it's underneath my rain jacket. Is it, where's my headlamp and I usually wear a lamp around my waist
Yeah.
for light. And I was like, where is everything? Joke at one point I literally like flipped up my jacket to like try to find food, and the light, like I left my light and I was like, I've gone blind. Like, so just some crazy like, I don't even know what I'm doing here. At one point I was like, why am I doing this? Like, this is so stupid. But after I made it through the night, got through the morning, which is actually just kind of more beautiful, and kind of chugging along, and I was like, I think I might finish this. I had some pretty low times in there.
Yeah.
Actually, kind of more mid-morning was one of my lowest times. And then when I got, I think it was like 10 miles from the finish, I was like, I think I'm gonna finish. And like at this point, I didn't really know what place I was. I was just
Yeah.
like, I'm gonna finish. And I saw my kids, and like we've talked about it before. Like, do you want to run? Do you not want to run? My daughter's a competitive gymnast. Like for her, walking to the car is really kind of endurance. So I didn't know if she'd want to.
Oh.
My son was like all about it.
Mm-hmm.
But they both just kind of jumped in, and like
Oh.
there was that thought of like, what if they can't keep up? I'm not slowing down for them, right? Like, and they both kept
I
up.
love that you
So that was
thought
good.
that.
Yeah, I did. I was like, what if they can't keep up? Like, I'm not stopping. Nope, I
Right.
am finishing this, and I want to be done. I'm
Yeah.
not going to delay this. So I'm
Yeah.
glad they kept up, because then I would have looked really bad if I like
If you
abandoned
left your
them.
kids behind, yeah. I
Yeah,
think
yeah,
I
yeah.
think all of us moms would have understood.
Yeah, right, but I don't think I would've gone over well. And so it was really cool to have them there, my husband at the finish line, my
Yeah.
parents who have never seen me do an ultra before,
Oh,
and
wow.
I'm pretty sure they came just because it was France, so they're like, "Sure,
Yeah,
we'll
why
come."
not?
You right?
Yeah.
So that was pretty cool to have all of them, and it was just, uh, yeah, kind of idyllic that it all kinda happened and came together, and, they were at another race that I finished, but I finished so late, that they wouldn't get up. They were like, it finished at, like, a track.
Oh,
I
okay.
had, like, fallen
Yeah,
asleep in
yeah,
the middle
yeah.
of the track
Mhm.
waiting for a finish, and I, like, "Nope, where are they?" They refused to get up, and so that was, it was cool that they finally like, "Yeah, let's."
Got to see
So,
you
yeah. Yeah,
in
exactly. So that
France.
was pretty exciting, and special that they wanted to be part of it this time.
Oh my gosh. No, it's so cool, number one, to be top American, but then to think that you have kids the age that you have, and you have the career that you have, all of this stuff. Like I just I don't know if you know her, but I just was chatting with Maggie Mertens, and she wrote a book about basically the history of women in running and talking about
Mhm.
all this stuff. And I mentioned that we were chatting. I'm like, from a time where women were too fragile to run because their uteruses were going
Mhm.
to fall out to a woman of advanced maternal age.
Right, yeah.
Like, how cool is that? Like, to work in a field where you know the history of kind of how we've treated women
Mhm.
as like reproductive, factories, to you can go out
Right.
and kick ass and freeze your hands off in
Yeah.
France.
Yeah, and have, like, a husband who supports me while I get to do
Right?
this, and not be like, "Hey, you're dropping your responsibilities of XYZ," but be like,
Right.
"I've got the kids, you're gonna go frolic in the woods." That's always jokes to me. He's like, "How long you gonna go frolic in the woods for?" And supports me to go frolic in the woods for ungodly amount of time, and picks up all the balls that I drop while I'm doing that,
Yeah.
right? And just even, like, having that be a thing, as opposed to,
Right.
like, "Well, sure, you can do it, but it better not get in the way of all your responsibilities." I mean,
Right.
that's what work was first, right? Just being in the
Right.
workforce was like, "Oh, if it doesn't get away," and now it's like, "Oh, we can do all these things." Um, and even later in life, like, I'm 42, almost 43,
Mm-hmm.
and, like, you kinda think, "Oh, past your prime." but still getting better and still like having
Right.
that like space to be able to do it. And not, I
Yeah.
mean, there's mom guilt. I don't think there's mom guilt. I don't think you can't get away from it.
Hmm.
Uh,
Right.
but being like, fine, people can think I'm a bad mom for, not being 100% devoted to my kids 100% of the time. But I think there's more and more acceptance that we're allowed to have
Right.
fulfilling lives in other aspects besides just childbearing or,
Yeah.
and if that's, again, not that that's whatever you want to do, but that's the freedom we get.
Right. That you can do
Um,
all that. Yeah.
right.
Is your
Yeah.
is your husband a runner too or no?
Oh gosh, no, 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 no.
Mine isn't
Uh,
either.
no, no. He rock climbs,
Okay.
so he still enjoys that. He's gotten into mountain biking more
Okay.
recently, but that's maybe a last, like, 3 years thing, 2 years thing, so that's way, way more recent, but no, he is not a runner.
Yeah.
He always says, "Well, somebody has to stay home and watch the kids," so,
Oh, that's
yeah.
nice.
Yeah, yeah,
Oh,
yeah,
that's
so nope,
great.
not a runner.
Now with your practice, I do find there's more and more. I'm in the DC metro area, and there's more and
Yeah,
more OBGYNs that are shifting to just GYN practice,
mhm.
and God knows there's a need for it. Do you work with a lot of runners locally, being in Colorado, and having a lot of active people?
A lot of active people, not
Yeah.
everybody is a runner per
Hmm.
se, um, but yeah, a lot of like most more people. I think Colorado is kind of an odd community where most people are really active. Um, and so a lot of like questions of whether it's with pregnancy when I did that
Right.
uh, to uh, you know, getting like how, post surgical, like when can I exercise again? Or
Right.
I don't want surgery until this day because my pickleball league ends that time, right? I do a lot of adjusting around that, or like how quick can I get back to my normal routine after surgery, after pregnancy
Yeah.
or whatnot. And yeah, that's very much a normal part of my everyday conversation with people.
Yeah. How much of that was a shift from kind of like what you learned in med school to kind of how you practice now? Because and obviously there's water in the bridge as far as time and how we understand activity and like pregnancy, postpartum, perimenopause.
Yeah.
Like, do you remember kind of what you were taught about kind of expectations for activity when you were in med
Yeah.
school?
Yeah. I mean, like even just down to, I feel like this was example of like after pregnancy, I remember a patient showed up 6 weeks postpartum and she was like, well, when can I start driving again? I was like, you haven't driven? She's like, no, I was told I can't drive until I get a, I'm like, you could have started driving 5.5 weeks ago. And just like a lot of it, I still see in the hospital.
Me
Like,
too.
yeah, like you can't do this, you can't do that. And I'm like, I mean, yeah, and everybody's different. So there's like, but just that, like, it's more of limited. And it's
Right.
hard because everybody's so different and nobody has the same progression in everything or anything, I suppose. Uh, but that, like, oh, I'm not allowed to do that. Oh, you mean
I
don't start right where you picked off, but like you can
right.
start way earlier
Yeah.
than you think. And in fact,
Yep.
the more you do, the earlier, the better.
Yep.
But start like don't think you're gonna pick up where you left off. You gotta start and slowly progress it. But yeah,
Yeah.
that like change in mentality was like kind of insane. And you see
Yeah.
it too in people like you're exercising already postpartum. Yeah. Like, and there's
Hmm.
shame in that for some reason,
I
or like,
know.
right. And it's odd. And I wonder if that shame comes from, well, I was told I couldn't, so I didn't.
And
But
so much of that is geographical too, but like
yeah,
even here, like I had a client even just a month ago, first baby, vaginal delivery, large medical system. She screenshot, the like
yeah,
whatever laminated thing was in her room. She was supposed to not, literally the paper said don't drive for 2 weeks and don't lift more than 10 pounds.
yeah,
And she's like, well, what do moms do that have babies over 10 pounds? I'm
yeah,
like,
yeah,
any
right.
baby in a car seat when you're carrying the baby in the car seat is going to
Oh,
be
yeah,
over 10 pounds.
well
Like
over.
that's just a fact. And she's
Right.
like, what do people do? I'm like, well, first of all, that's not rooted in any sort of evidence
Yeah,
whatsoever. But like, why is that still in a major medical system?
right. And it's almost
That's
like those old things that we don't even think. And
right.
then, you just, I guess, if medicine's going to take the let's not get in trouble, they're going to do the most extreme, right? Like this patient, she had a hysterectomy and she came to her 2-week post-op visit. And usually I say like start walking like right away, but like actually going on a walk, like
Mhm.
try that day 5, day 6, day 7
Mhm.
post-op, see how it goes. If that went well, increase the time, increase the intensity. Like, and so I
Mhm.
came back, she came to her 2-week post-op visit and I was like, how is like movement going? She's like, I already ran 2 miles. I was like, really? Oh God. And she's like, oh, I'm fine. It was great. Like I've already increased from there. I'm like, okay. But like I would never tell anybody to do that. A, because I don't want to feel
Right.
them to feel like they have to do that. And B, like, heaven forbid, what if like something happened? And then it's like, so I think there's a bit of like err on the most cautious side of it
Yeah.
because heaven forbid, like I had another patient who had a leap, which is like an
Mm.
in-office like excision of kind of the top, I don't know, centimeter, maybe not even, of your cervix for like
Mhm.
precancerous cells. And she went, I want to say I did it on like a Wednesday or Thursday. She was walking on the treadmill on Sunday.
Mhm.
I wasn't on call, but was walking on the treadmill. She didn't say it was like super, like, it wasn't super exertional. She just said she was walking on the
Yeah.
treadmill and started hemorrhaging, went to the
Mhm.
hospital. I wasn't on call, so my on-call partner saw her, couldn't get the bleeding to stop,
Oh
ended
gosh.
up in an emergent hysterectomy because of it. Was it because of
Mm.
that? Was it not? This girl went running 2 weeks post-op. This girl
Right.
went on a walk post a minor office procedure, and
Right.
it's, like, those kind of things that, like, freak you out, like, "Oh, no, don't do anything because I don't."
Yeah.
And what do you do, right? So,
Right.
I always kinda walk that line. I'm like, "If it hurts, don't do it."
Yeah.
Like, start low, start little, slowly progress. If it hurts,
Yeah.
don't progress it. If it doesn't hurt, try a little bit more the next day. But like, how do you with those two stories, how do you figure out what to counsel people?
Yeah, well, that's right. I feel like it's not, I mean, it's yeah, I mean, I feel like things have shifted so much too, where, like you said, there's like, don't do anything. And now we have so many people that are doing a lot and we know that it's safe and we have better,
Mhm.
research and information. I mean, just, in the last couple months, exercising supine and doing bench press, totally fine for mom and baby. We had a couple papers come out. It's like, great, finally, I feel
Mhm.
like there's so much we've moved forward, but it also comes back to, again, that person in front of you. And I feel
Yeah.
like it's so hard to be just an average person trying to figure things out and do the DIY approach because
Right.
they're going to be this extremes. You and I can see that, but that person has no idea where to
No,
put
right?
themselves in the middle. And there is some degree of chance to that.
Yeah. And there's
Um,
also, there's your pre-fitness level, right?
mhm.
Like I used to tell patients like who are pregnant, like, about exercising. I was like, well, if you weren't a 5K before pregnancy, probably not the time to become one.
Yeah.
But if you ran a lot before, you can probably continue as long as it's comfortable. So
Yeah.
maybe it's not time to explore new, but if that's something you're used to, if have a higher
Mhm.
endurance level, higher fitness level in general, you probably can do a lot more.
Yeah.
But then does that shame the person who was fit before and is like, this is so uncomfortable. And you have your own pain and tolerance
Yeah.
level. And, I try to get most people into PT because I think that can help guide people.
Yep.
Because I mean, unfortunately, I don't have the time for that, right?
Right.
But
Right.
a physical therapist has the time and the physical space
Yeah.
to kinda help that process along,
Yeah.
so that way people can feel like they're doing exactly what they should do, not too much, not too
Right.
little, they're not shamed on either side,
Right.
but doing it in a way that's safe for them. Because I
Yeah.
think on the other side, people feel guilty for not being active enough or not doing enough,
Yeah.
and, like justifying, "Oh, I'm not running. Oh, it's because of" right? And feel like that they need to justify why they're not,
Right. Well,
and it
it's yeah, I mean, even that part, it was just some of the research that's come out more recently, like the waiting, like not necessarily starting anything new in pregnancy. We're actually talking about like if you're not exercising, this might actually be an okay time to start doing
yeah,
something so that
something.
you have the benefit of that 9 months because we know it's good for you and the baby.
Yeah.
But yeah, I mean, those of us that did navigate, like I had awful SPD during both of my pregnancies that now I know I probably could have addressed, but at the time, I mean, my oldest is almost 15. It was like rest, put a belt on,
Yeah.
don't do anything. And now how I would have treated myself would be the exact opposite
Right.
of that. It's hard to kind of figure out and navigate that without somebody to kind of help you piece those things through.
Right. And then
Um,
it's also hard to figure out like what's real, right? Like
right.
after a vaginal delivery, after a hysterectomy, I guess even after a
Yeah.
C-section, like we say pelvic rest for 6 weeks. We ain't joking. Like
Yeah.
that's not, but if you hear that, but then you also hear you can't drive for 6 weeks, you can't drive. And you're like, well, that's
Hmm.
what do you believe? And then also you could
Right.
actually do something that's really dangerous
Yeah.
because you're given this false information. I think that can apply to a lot of things in the medical field,
Yeah.
especially with, TikTok and medical advice from non-medical
Yes.
professionals, right? It's like, what do you believe, right? And it's hard
Yeah.
when you're given information that may not be up to date, accurate, or
Right.
correct, but you're also fed that with information that is
Right. Yeah,
medically
no,
based.
it really is a double-edged sword. I mean,
Yeah.
for you kind of thinking back, I mean, your kids are they middle school, late elementary?
Yeah, I have a fifth grader and an eighth grader. So,
Okay, yep. So
yeah.
you're in both there. I mean, we didn't necessarily have great. It was getting better, but like, what information when you were trying to navigate return to exercise? You're seeing your community. There's people more active in postpartum and pregnancy in your community, probably, and then you're navigating kind of what you know from a medical perspective. How did you figure out the pathway for yourself?
Oh, I didn't. I made it up on my own. There was
Exactly,
like
exactly.
12 years ago, there was no,
No,
and
I know.
I hid it. I didn't tell anybody. With my daughter, I started
Yes.
running 1 week after, because I felt pretty good. No, it was 2 weeks. I waited 2 weeks, and I felt pretty good, and I was like, "Well, I ran up until the day I delivered, like,
Mm-hmm.
I don't," and I went on walks and stuff, but I was like, "I wanna run again." So I went, and I
Mm-hmm.
ran until I couldn't run anymore, and then I walked myself home, and then I tried more the next day, and it wasn't. I told nobody. I told nobody what I was doing,
Yep.
uh, because I didn't wanna either do something wrong and then be like, "Oh,
Right.
yeah, that's because I decided to do that," but I fine, like, it had no problems, right?
Right.
Uh, but there was no guidelines back then. Like I said, that was the era
No.
of you don't
Mm-mm.
move for 6 weeks. Like, if
Yeah.
heaven forbid you pick up your baby, you
Mhm.
might be causing long-term damage, right? Like, there
Yeah.
was nothing well, and I even there was no data. It was made up. I feel like it was
Yeah.
literally like, "Here's random things we can say," which, in medicine, you sometimes do that because you don't have data, so you have, like, the best
Yeah.
guesstimate. I mean, like,
Yeah.
there's no data. And when I first moved here, there's like no data on how high elevation you can go in pregnancy. Like there's no real data on that, right? And I remember
Yeah.
asking my partner when I started, I was like, what do I tell these people who want to go to the top of Pikes Peak, 14,000 feet? And he's like, just make sure they don't go up for long enough. Like, they don't spend the night there, but they go up
Yeah.
to see and then come back
That's a
that's
very
fine.
valid question for
I
somebody,
know. And I was
right?
like, where'd you get that information from? He's like, living here for this long. I was like, okay.
So
Right.
you
Like
know what?
a lot of it
Margie
is just,
Margie Davenport, she's in Alberta. Her husband works in high altitude research, and then she does pregnancy and postpartum exercise
yeah.
research. I think she actually there might be a couple of papers on that when they were in Nepal.
Yeah.
So if anybody's interested in that, go dive down that rabbit hole.
Yeah,
I told
yeah.
her anytime she needs help in Nepal, I'm all hers.
Yeah, right,
But
I
she,
know. You
yeah,
need
but
help,
I
I'm
mean,
here.
it's all going to be kind of anecdotal stuff. It's not going
Right,
to be, and
because you
hopefully,
can't experiment on
yeah,
pregnant women,
right.
logically, right? I mean,
Yeah.
makes sense, but yeah, I mean, that was a while ago when I first moved here, and I think now
Yeah.
there's a little bit more, like, kind of, and if you bring a pulse ox, you just wanna make sure your pulse ox is above, like,
But
85% or
you're just
95, whatever it is.
DIYing it and you're the medical
Yeah,
professional, right?
right? And it's like, "Oh, this feels weird just to kind of make up stuff just like, oh, okay,
But
alright,
you know
okay."
what? Back then, if you had said out loud to a pelvic floor PT that you were running at 2 weeks postpartum, we probably would have shamed you.
Yeah, oh, yeah,
Honestly,
right?
honestly, we would have shamed you.
Yeah,
And
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 I
and
didn't
I feel bad about that.
right?
I
And I didn't
do.
tell anybody.
As you,
I did
yeah, I would
fine.
have been the same. Yeah.
Yeah, and then with my son, I had a much rougher pregnancy, but I started, like, 1 week postpartum.
Mm-hmm.
It was more treadmill because now I've got 2 kids, and I am
Right.
not pushing a stroller, especially in Colorado where nothing is
No.
flat, and I was like,
Yeah.
"Alright." But I'd run on the treadmill, as far as I could, half a mile, did great, right? Get off. The next day, I try to go, 0.55, right? Just a touch more each
Yeah.
day. And I started 1 week because I felt good. I felt better.
Yeah.
I was never so excited. to give birth, like labor, I was ecstatic because I was done being pregnant. Like it was such an awful
It's
pregnancy.
not
Like
fun.
labor was the best day of my life. I was ecstatic that my water broke. I was like, finally the end of this. So I think I was just so happy to not be pregnant anymore that I was like, I can run. So I like started running 1 week after. I didn't tell anybody. Nope. I didn't admit it to
Yeah.
anybody that I was doing that because and that was 10 years ago.
Yeah.
There
But
was
you know
still
what?
no.
But now I feel like it's one of those things that, like, if you're having a conversation with somebody, if they feel good enough to go out and, be within like some reasonable
Hmm.
requirements, I'm like, you're gonna know
Yeah.
right away if that doesn't feel good. Trust me, you
Yeah.
will.
Right.
And the fact that you even had a thought to be like, let me go run, that already tells me
Right.
generally kind of how you're feeling. Because if you feel like crap, and I know what that feels like,
Yeah.
it's not even a thought. You're barely thinking about how to get out the door. So I think that, I mean, we've got to give women some credit to be like, okay, this, if I feel good enough that I'm going to bring up this
Yeah.
idea, like,
And
do
and
it.
also the grace to be like, "I don't feel good. I'm not doing it."
Exactly.
And they're both
There's no
okay.
prize. There's no
Yeah,
prize.
right?
I haven't found
Uh,
it.
exactly. So either way is okay, but it is hard to navigate when you don't have standards,
Yeah.
right? When you
Yeah.
don't have evidence-based
Yeah.
to say, right? And yeah, and like I had a friend who had a ruptured appendicitis. So,
Mm.
and just listening to her experience after, because like a lot of the surgery I do is laparoscopic, right? So kind of
Yeah.
similar, right? And she's fit before, and listening to her kind of experience has definitely changed how I counseled people,
Yeah.
and she was up and moving and doing a lot real quick, but she's like, but heaven forbid I need to go upstairs. You better give me double the amount of time because it's just
Yeah.
slower. But
Right.
I went biking and, and she was able to do stuff, but also there was limitations. So kind of
Mm-hmm.
like navigating that as to how you feel.
Yeah.
Uh, yeah, but it's hard when there's no like, I remember they told her some
It's
stuff too.
coming. It's
Yeah. Well,
coming.
they told her some stuff as far as like, oh, you can't do this, can't do this. And she's like, really?
Where's the
I
study
was
on
like,
that?
I know. I was like, shh, it's not really real. We make it up. Don't worry about it. See how you do.
I
Like I
love
had to
that you
tell
say
her that.
that.
Like we make it up. Don't worry about it. I'm not really, but kinda.
No, but we kind of do. I mean,
Yeah.
let's talk about making it up, and let's jump ahead to talk about perimenopause and
Yeah.
menopause. That's my age and stage at this point. It sounds like you're kind of headed in that
Yeah.
direction. It is the Wild West out there, and we have more women than ever that are wanting and staying active,
Mhm.
kind of through these phases, and expect to stay active. What's something that you kind of chat about and counsel with clients that are like, hey, I'm a runner, always run, got back to running after having kids. What should I kind of pay attention to next? Because it's literally a dumpster fire out there of information.
Yeah, yeah, right? I mean, that's hard part, like, after estrogen starts decreasing, like, body changes, and I always kind of equate it to, like, it's reverse puberty.
Hmm.
I feel like I heard a term more recently, like cougar puberty or something,
Yes.
but I don't know, I don't like the term cougar, I don't know
I
why.
don't either.
To me, it feels a little bit like
A little raunchy.
yeah, and, like, kinda disrespectful, like, we're looking for approval, I don't know, anyways, so I just call it reverse puberty. Uh, and, like, the types of thing that were important before maybe aren't the same now, and as estrogen decreases, that's gonna change, like, your ability to build muscle, your ability to maintain muscle,
Hmm.
and so what exercise looks like and what your priorities are with exercise might change, right? Like,
Hmm.
I hate lifting with a passion.
Do
It's not my
you?
jam. Oh, I do, I hate it. I only do it twice a week, and even then, I mostly do it once a week because I go to a class once a week,
Yeah,
which
I
makes
have to
me
go to a
do it.
class. Yep.
Yeah,
Hmm.
but I'm like, "Oh,
Yep.
yeah, I'll just do it Wednesday in the class, and then I'll do it Saturday or Sunday." 90% of the time, I don't.
Okay.
But it's so important because my ability to maintain muscle, to build muscle is just gonna go down with age, and I don't wanna be
Yeah.
one of those frail little old ladies, right, who can barely get up, can barely move. If she grabs something wrong, she breaks her bone because she's fragile,
Yeah.
weak, and right? And so building and maintaining muscles is gonna be way more important
Hmm.
than cardio at this point.
Yeah.
And even knowing that I don't do it very often, but so that kind of changes. And then when you have that muscle loss, like your metabolism is going to go down. So I hear
Hmm.
all the time, I haven't changed anything and I'm gaining
Yeah.
weight. because you haven't changed anything, you're gaining weight. You need to start changing and
Yeah.
adapting because your body is. And if
Yep.
you don't pay attention to that, yeah, think like it's gonna happen. And so just that mind shift of like, oh, I get these number of steps in. Yeah, throw some weights in those hands or throw some
Mhm.
weights around your ankle. Doing that is going to be more important and long term to prevent osteoporosis, to
Yeah.
prevent like muscle wasting to the point where you can't lift things up. You can't even lift your
Yeah.
body up and move in a coordinated way. And so that's kind of the biggest thing.
Yeah.
There are some good studies coming out that estrogen, although it's not FDA approved for weight loss, it does decrease that muscle wasting that we see in that time
Mhm.
frame. So combined with exercise, so it's again not alone,
Mhm.
combined with estrogen and exercise, we see less muscle wasting in
Yeah.
the postmenopausal women. So, I mean, the more and more we tear apart that terrible WHI study that
Yes.
did so much damage,
Yep.
uh, that we're learning more and more is like more benefit we're
Yeah.
getting from it. And so it's interesting learning that, and like counseling has definitely changed as far as like, all right, is this hormone therapy appropriate for you? Is it not? Like,
Mhm.
what are those things that would change your mind? And it used to be like, oh,
Yep.
you don't want it? Okay. Now it's like, have you thought about the benefits as opposed to just,
Right.
ooh, the scare? Um,
Right.
so that's, I think, the biggest and first thing if we don't get into actual hormone therapy is, all right, what needs to change,
Yep.
both diet and exercise wise,
Yep.
uh, as our bodies change.
Yeah, and it really is a mindset shift if you haven't lifted
Hmm.
weights before to start doing it. I started doing barbell work, I guess, when my
Yeah.
youngest was 3, and I had hip issues before that, and all that stuff got a lot better. And so you need to find that thing that at least you go to
Hmm.
your class once a week and you stick
I
with
know.
it, and yeah, that thing that makes you go. And if you do
Yeah.
that, then you'll be fine. Yeah, I probably
Accountability.
wouldn't do it on my own. I literally have a whole gym here in the office that has barbell equipment, all that. I need to
Yeah.
go to a class.
Yeah, me too. I have all the things,
Yeah.
you got all the setup, and I still, if I
Mhm.
don't go to a class, I'm like,
No,
that's so pretty. Look at it sitting down there. Like,
I need to be told what to do.
yep, and I need to be held accountable, like, "You paid for the class,
Exactly.
you're gonna go for the class now," because it's not
Yeah,
my jam, but
that's
I
okay.
I know it's important, so I've added that. That's probably been, like, 2 years now where I'm like,
Good
"All
for
right."
you.
Yeah.
That's awesome. That's awesome. All right, you have you've dipped your toe in on podcasting. Tell us a little bit about your journey with the podcast.
Yeah, oh my gosh. Uh, it's is I was something that was on my mind that I wanted to do, mostly because there's just so much information out there that I was kind of like, all right, let's cut the BS. Like, what do you really need to know, or what is normal,
Hmm.
what is not normal, and I thought it'd be kind of fun. It's been a lot harder than I thought. Mostly just like picking down a time to do it.
Yes, especially when
Yeah,
there's more than one of you.
right?
Yes.
Not to mention just like listening when you're editing it, listening to yourself, being like, oh my god, I sound like
I
that.
have an editor. Hi, Laura. Love you.
Yeah, yeah,
I'm
because
like,
it's
if I
like,
had to do that, I would never do it. I love having
right,
conversations. I will not do the back end.
right, and I just am like, "Ooh, yeah, that's," so it's been kind of, interesting, and then even just, like, I don't know, I'm sure there's algorithms and fancy things I should do to, but if we get an episode out once a month and get, like, a little
Yep.
Instagram story, like, super proud of myself,
Yes.
because it takes a lot of time and a lot of energy, and
Hmm.
then it's also, like, I need a quiet space where nobody else can hear because I don't want anybody else to hear
Yes.
my awkward editing, and then actually, like, posting it and getting all that stuff up, but it's been kind of fun.
That's good.
Like trying to explore different ideas and topics and like what do people want to hear and what questions do people have? Because I have a lot of stuff that I could talk about, but I don't know if that's what people want to hear or not hear. And so it's been interesting. Uh, but having Emily, who is a pelvic floor physical specifically, it's like I even learned stuff on there. I'm like, oh, really?
Yeah.
Interesting.
We're
Cool.
fun people.
Yeah, right, right.
We're
That have,
fun
like, similar
people.
stories and similar,
Yeah.
but very different angles of it. Um,
Hmm.
so yeah, so it's been, a learning curve, and we're gonna try to be more consistent. That's our next goal.
But that's like everything, right? Like
I
that's how you
know,
got running. That's how you got your business going. Like you just
right?
it's the same thing. It's like how do I figure out the consistency and how to keep this moving forward? And then once you get that, it's pretty easy. How'd you
Yeah,
get to go to your weightlifting class, right?
I know, right? Make it a routine as opposed to an extra,
Exactly.
right? It's not an extra,
Exactly.
it's a normal, yeah.
Yeah, totally. All right. Well, I know we're a little short on time. When we finish up our episodes, we have a couple questions for our guests. The first
Okay.
one, a book you're reading or podcast that you're listening to right now.
Ooh, so I don't really read. Uh, I
That's
listen to
okay.
books. I listen to books on tape. I
Okay.
listen to books on tape a lot. Like I did, I listened to 3 books during UTMB,
Oh my
just because
gosh.
it's just like, and they're not good. But I'm not like literary magic over here. The housemaid, the Frida McFadden, I think is her name.
Okay.
There's like the housemaid checks. It's just a series of 3 of them, and that's what I just finished listening to. But they're like murder mysteries, like thrillers, sometimes a little bit spicy in there because, why not?
Do you even remember what they're about?
I remember ish.
I was gonna say I don't know that I could like pay attention to technical trail and remember what I heard at the same time.
Yeah. And that's the thing is like it depends on like a book that's good for trail running is
Hmm.
its own little genre because it
Right.
has to be a book that's not so complicated that you're like,
Yes.
I didn't pay attention for the last 3 minutes. What is happening? Like, I don't even know where
Yeah.
am I? So the ones that like bounce back and forth in time, forget it. Ones that have like many different angle, forget it.
No.
If their names are complicated, that Akatar series, I had no idea what was happening and I had to stop because I was like, I don't
Okay.
know what's going on anymore. So it has to be a book that's like pretty straightforward, pretty easy, pretty entertaining. But if you don't pay attention, that's
Okay.
okay. You'll pick back up and keep going.
So we're
So
gonna start
that's
with
what it.
Ultra Trail book recommendations by Lauren
I
Puretz.
know, right, right. I know. Every once in a while I'll screenshot like what I just finished and be like, "This is a good one for trail. This
Oh,
is
that's
not a good one for
amazing.
trail." Yeah.
Ah, I never thought about that. What's your favorite activity since becoming a mom? And it doesn't necessarily have to do with your kids.
My favorite activity since becoming a mom is hiding in my closet. One, is that a thing?
Isn't that where you podcast? Is your closet?
Yeah, yeah. It's because I was hiding there. We started off when I used to put myself in mommy timeout,
Hmm.
because, kids don't understand complex things, like I need an emotional break or I'm frustrated, I'm gonna yell and scream, but they do understand the concept of timeouts. So I used to put myself in mommy timeouts in
That's
the closet.
brilliant.
Yeah, and so the closet became, like, my little place that I hide, that I, do whatever. So, yeah, hiding in my closet, I guess,
I
is my.
love that. I think that's where I heard you first. You were on Trust Society podcast. You had like a couple
Yeah,
of different episodes. You're like, I'm in my closet. I'm like,
I
that's
know.
amazing.
Yeah.
All right, last one here. What does it mean to you to be an active mom?
Um a role model, right? For your kids. Uh, I think that's what it means to me. Like, why am I active? Well, because I want my kids to know that this is what healthy and happy looks like.
Yeah, and you're doing all the hats and doing all the things, and it's
Mhm.
happy and healthy, right?
It's okay to drop some of them and keep going, but more
I
human, and
I
that's
have a friend
normal.
of mine. She's like, you have balls, you have glass ones, you have rubber ones. Just don't drop the glass ones, and
That's
you're all
right.
good.
Exactly. I love that, right? Because I always sort of joke that I'm a hot mess mom because I all these balls in the air and most of them hit the ground. But you're right. Don't drop the glass ones. That's a good point. Prioritizing and uh, yeah, that's brilliant. I love it.
I love that. All right, if you guys want to hear more about Lauren's story, we just got a very brief snippet into all of her hats and all the things that she does. You can check her out over on Instagram, Lauren1642. I'm not sure what 1642 is, but
It came from when I was because the AOL days, right? When you had to pick your
oh,
AOL instant messenger name.
that's so
And my
sweet.
first one was Piglet because I love Winnie the Pooh in high
Oh,
school. But then I kept getting dirty messages about and I was like, I gotta change this. And so 16 is my favorite number. I used to play soccer. And then
okay.
as I got better, they just ordered by size.
Mm-hmm.
So they were like, "You're too small to be number 16." And I don't like odd numbers. So I wanted even numbers. So I either had to pick 4 or 2. And so depending on the age I was at in high school, right? I was either number 4 or number 2. It was my soccer number. And so 1642, random
And
from
now you
high school.
know. I'm
Yeah.
so glad I asked that.
Yeah. Just random. I know.
So if you want to know more stories about Piglet,
Yeah,
you can check her out over on
renamed.
Instagram. Thank you so much, Lauren, for sneaking me in between patients, and congrats on your
you.
performance over at UTMB.
Yeah, thanks. Nice to meet you.
You too. If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.